Good afternoon and welcome to this quarter's UNT World Town Hall. I'm Paul Corliss, Chief Communications Officer for the UNT system. Thanks everyone for joining us today. I'll be moderating today's virtual forum with Chancellor Lisa Rowe. Today's forum includes a coronavirus discussion with Dr. Diana Cervantes, Director of UNT Health Science Center's Epidemiology Program, followed by Q&A with Vice Chancellor and Chief Human Capital Officer Shireen Gilliam-Holmes regarding our new Employee Assistance Program and the annual Gallup survey. And we will finish today's town hall by answering questions submitted by faculty and staff across UNT World. Thanks to all of you that submitted questions. But first, we'll get started with opening remarks from Chancellor Lisa Rowe. Lisa, if you'd like to turn your camera on, or you already beat me to the punch, and say hello to everyone with remarks, we'll get started.
Hey, Paul, thank you very much. And thanks to everybody for joining us virtually today. And thanks for our panelists for joining us today. I'm really pleased to have Dr. Diana Cervantes and our Vice Chancellor and Chief Human Capital Officer, Shireen Gilliam-Holmes. And I thanks to all of you for submitting questions that for our panelists today. I think that really helps to make sure that we're shaping these town halls to what are the most important questions out there, and we're focused on those. The video today is certainly, we're going to be recording that and archiving it so that those who couldn't attend live can watch it later. We have some exciting news to share. Probably you guys might know it just because we can't contain ourselves, but we have had new record system enrollment of now over 49,000 students, and that's over 4% growth from last year. So congratulations to all of our member institutions on their successful fall headcount numbers. Every single one of them is a record high. UNT is at 42,372, and that includes a record freshman class of 5,533. And that's about 4% growth. UNT Dallas is at 4,230, really excited about their new record high. And our UNT Health Science Center is at 2,458. And that is about over 5% growth for the Health Science Center. So really excited about that great news. And we have some new news, some really good news to share on the battle of the coronavirus front. At this point, our safety measures are really playing out well. Our system and campuses have really taken all of everything to heart and the primary goal of keeping our students, faculty, and staff safe. And we've been able to do that. And over the last couple of weeks, we've had some very positive, our number of positive cases have dropped significantly across our UNT campuses. And so, of course, that doesn't mean we're letting our guard down. We will continue to monitor the virus. We're going to work with our local entities and react accordingly to ensure that we have a safe environment for all of our locations. So I'm sure our next guest is going to have a lot more helpful information to share about that. So Paul, I'm going to turn it back over to you for Dr. Cervantes' questioning.
Absolutely. We've kept Dr. Cervantes busy this week. She's got her camera on already. So Dr. Cervantes, if you haven't had the chance to interact with her and see her or hear from her, she's really built a brand here in North Texas as one of the foremost experts on coronavirus. She's participated in dozens, if not hundreds, of media interviews, both local and national. And this week alone, she's not only participating in our town hall, she participated in a town hall at HSC, and tomorrow she's going to speak at UNT's TED Talks event. So Diana, thanks so much for joining us today. We appreciate your time so much.
Thank you.
So I'll jump right in and just ask questions about kind of where we are. And let's begin just broad overview. Can you kind of share where we are, Dallas-Fort Worth, as far as coronavirus and the Delta variant spike?
Right. So right now in the DFW area, we are seeing the COVID numbers, the cases, the hospitalizations, they are dropping, albeit slowly. We still are classified in that high category of community transmission. And there's 4 levels. There's high, there's substantial, there's moderate and low. And we're still at that high category. As far as the Delta variant goes, it is the predominant variant, and it has been that way since July. It makes up over 99% of the circulating variants right now.
So how do we compare DFW and Texas with the rest of the country?
So I talked about those 4 levels of community transmission. Right now in the United States, about 95% of the counties in the United States are at that high level of community transmission. So that's where we are here in the DFW area. And in Texas, there's just a handful of counties who are not at that level. They're at a lower level. But in general, we're all kind of in the same boat, right? We're on that high community transmission. Our numbers, the trends are dropping, and that's the United States, that's Texas, that's here in the DFW area. One of the things that's, of course, been a little bit unique, different in this COVID spike is that children that are 11 years and younger, they have been really affected. We've seen hospitalization rates much higher, the highest that we've ever seen in the pandemic so far. And of course, a lot of that has to do with kids going back to school and getting back to their routines. And also, of course, because many of them are not eligible to be vaccinated. But overall, the numbers are still low compared to adults. But of course, those hospitalization rates have been pretty high for that age group.
You had mentioned the Delta variant is the dominant variant we're seeing right now. But we have heard some other variants. Are there new variants that we need to be worried about? And can you kind of give us a layperson's term explanation of how a virus mutates and develops these various strains?
Right. So the one purpose of the virus is to make more of itself. That's what it does. That's really what it exists to do. And when it's making more of itself, it's replicating. There are small changes that happen in the genetic material of that virus just by chance. Now, the majority of the time, those things that happen by chance, they really are not beneficial at all to the virus. Actually, most of the time, it's bad for the virus and it puts an end to that variant. But sometimes it is beneficial to the virus. And when I say beneficial, what I mean is that those changes allow that virus variant, to be able to more effectively and efficiently enter our cells, to be able to make more of itself much more quickly. Or it can also affect the way our immune system recognizes it. So maybe is it able to recognize it as easily? So that's basically what a variant is. And when we think about what are we concerned about when we think of variants, we really worry and we get concerned. The reason we really keep track of them is we want to make sure that our vaccines are still effective, that our diagnostics tests are still able to pick them up, and of course the therapies that we have are still very effective. And that's exactly where we are with the Delta variant. So the Delta variant is classified as a variant of concern. So, what does that mean? So it basically means that there's some evidence indicating that there is some potential loss in how well, again, our vaccines, our treatments, our diagnostic tests are working. But I want to make it very clear that Delta variant is not at the highest level. The highest level of classification is a variant of high consequence. And that's when there is clear and strong evidence showing that, yes, this variant has made such a great effect in reducing how our vaccines and our diagnostic tests and our treatments work, to the point that we're seeing an increase in severity of illness and in cases. We're not there with the Delta variant. We don't have any variants that are in that highest category. And as I mentioned, Delta it's pretty much just taken over, right? It's the dominant variant. It's outcompeted the other variants, to the point that now here in the United States, we have kind of a new classification where we've put all the other variants in. It's called the variants being monitored. It means that, again, there's some evidence indicating that, there's changes in that virus that make it a little bit more, in that variant that makes it a little bit more effective and efficient. But it's because the Delta variant is like 99% of all the variants. They've kind of said, okay, well, all the other variants, we see them so rarely, we've just put them in this other category. They're there, there's a potential for them, but it's really not a concern. And that's kind of where we are. We heard a lot about Zeta and these other potential variants. But again, we see them in such low numbers right now that there really aren't any variants of concern, other variants that that we need to be really concerned too much about. Again, that could change because, again, the virus's job is to just make more of itself. So that could always change.
Well, obviously vaccines are, kind of the hottest topic we have going on in the country right now. And I wanted to ask you some questions. And the first one's pretty simple. What does the data say right now about getting vaccinated? We should still get vaccinated according to data?
Yeah, absolutely. The data just continues to build in favor of getting vaccinated. All of the currently available vaccines that are out there, they are very, very effective at preventing hospitalizations, preventing severe illness, preventing death. It ranges somewhere in the high 80s up to 95% effective at, again, keeping us from having the most severe outcomes, which is obviously the things that are really important to us. But the data is also building that even though the vaccines weren't meant to prevent infections at all, they are still pretty effective at that, somewhere in the 60-70% effective at preventing any infection. And then when we do see those breakthrough infections, so when people are vaccinated and they still get infected, the science is building showing that, in fact, those virus levels in people who are vaccinated, they come up and they come down very quickly compared to people who are not vaccinated. So they're infectious for a shorter period of time. So they're able to transmit for a shorter period of time, people who are vaccinated compared to people who are not vaccinated. And there has been, some safety concerns, and people have asked about the adverse events that have happened. So early with the Johnson & Johnson vaccine, there was a concern with a clotting disorder that you see with people that get low platelets. And there were some cases, I believe it was 1 in 7 million people, women between the ages of 18 and 49, that developed this clotting disorder. And unfortunately, there were 3 deaths that may have been associated with that. The other concern was for the mRNA vaccines in teens, getting a condition where you have an inflammation of the heart or the lining of the heart. Again, that's very rare. As far as I'm aware, there's been no deaths reported with that. So again, they're very rare, these adverse events. And ultimately, the benefits of the vaccine are going to outweigh the risks.
Question about the booster shots that we've heard about. It's been recommended now to have immunocompromised populations get a booster. Do you see that being recommended to the general public in the near future?
So, of course, very recently, the Pfizer vaccine was recommended for people who are 65 and older to get a 3rd dose, and people who are 18 and over who have any underlying conditions, and also if they either work or live in a high risk kind of setting. And high risk basically means they come into contact with a lot of people, right? So teachers, healthcare workers, emergency responders. And so we're kind of waiting to see, what the data is going to be for the other vaccines to recommend a 3rd dose. I'm sure it's coming down as well, but right now we are just with Pfizer at that 3rd dose.
If you received a Moderna vaccine and then we're getting a booster, do you have to get Moderna, or can you get either or? And where does Johnson & Johnson fit into that mix?
All right. So as you could see with the way that the 3rd dose for Pfizer was approved, they were very specific. If you receive Pfizer, then you can get the 3rd dose. They made it very clear it's not open for any of the other vaccines at this point. And, a lot of that has to do with kind of the limitations in the way that the data is provided to the FDA, and not so much the science, because the science is also building on what does that look like when people mix and match. And it is building, but it does show that you can have potentially a more robust immune response if you do mix and match. But again, the science building, and I think it's just going to take some time for all that regulatory kind of issues to catch up with it.
Sure, that makes sense. Well, the other polarizing issue has been masks, right? And
Right.
As an expert and epidemiologist, what's your stance on masks right now in our area?
Yeah, I think that, of course, the vaccine is a great layer, but as I discussed, like any other vaccine, it's not 100%. So we want to make sure that we're doing the very best to protect people who can't get vaccinated, to protect people who, even though they are vaccinated, they are still at high risk for having very severe illness, right? So we want to make sure that we are doing those things. We're using masks, we're using that physical distancing. We want to make sure that we're doing what we can to make sure that we are protecting people. And I always say that, just try to limit the 3 C's of COVID, the close contact, the crowds, the cramped spaces, as much as possible.
A question that we've talked about here in my office is some of us have young kids in school that are not vaccinated. Does that create a different set of precautions you should follow? Because they're obviously, at school all day with a bunch of friends and many of them not vaccinated and then coming into the household. Does that change the rules up for somebody in that situation?
Yeah, of course. Yeah, our kids are out. My daughter, she's at school. She's out and about now, much more than she was last year. So being out and about, she's exposed. She has so many potential exposures. So Luckily, she is 13. She is vaccinated. But for kids who are at this point cannot get vaccinated, you definitely want to make sure that you are still modeling that really good behavior. Obviously, if they're eligible to get vaccinated, get them vaccinated. You run out and get vaccinated. But still, you want to make sure that you're wearing masks when you go out, when you're going out to the store. You want to model that behavior as much as possible, do things outdoors. You want to try to reduce the risk as much as you can at home. And I think it's really important for parents to be really proactive, make sure that they have a seat at the table with their schools, that they are speaking to the administration. What layers of protection are you implementing besides masks? I mean, what are you doing? Are you trying to increase airflow? Are you trying to do things more outdoors? How are you handling dances and pep rallies? How are you doing these things? So that's important. And I think the other thing is, we need to be very vigilant with our kids if they have any signs and symptoms. Right now we see a lot of little allergy type symptoms. If our kiddos have any type of signs and symptoms, we really want to make sure that they're staying at home, getting them tested before we send them back to school. Because although people can transmit COVID before they have signs and symptoms, we know that once you get signs and symptoms, obviously you're sneezing, coughing, that just increases that chance. And you want to make sure that, again, get your kiddo tested before sending them back to school if they have any signs and symptoms.
Right, makes sense there. Now, we're kind of approaching what is traditionally flu season. How do you expect flu season to play into all of this? And is it necessary if you have it? Does the coronavirus vaccine do anything for the flu, or is that a whole separate deal?
Yeah, so it is hard to say exactly what our flu numbers are going to look like. Last year, they were really low, but last year we were doing a lot of prevention measures, a lot of COVID prevention measures, and we've gotten a little bit more relaxed on those measures. So we're going to have to see how that really plays out with our flu numbers. There was another virus, RSV. You may have heard about it in the news. It's another childhood viral disease that typically you see in the winter and the spring, and we didn't really see that many cases. But then, of course, once things started getting very relaxed, we started seeing some cases in the summer. So we'll have to see how that plays out. And, we have to also think that there are certain, just like there's different variants of COVID that tend to be more severe, there's certain types and subtypes of flu that can cause more severe flu seasons. So we have to think of that. And I think, lastly, we have to always think, regardless, we want to run out and we do want to get the flu shot. You can get the flu shot and the COVID shot at the same time. It is safe because you can't get infected with both viruses. So nobody wants that.
Appreciate the clarity there. So as we kind of wind down our Q&A with you, let's couple big picture things. Realistically, when do you expect the pandemic to end?
That's the $1 million question, Paul. I wish I knew when it's going to end, but really, I think we need to accept that it's never going to just end abruptly. It's not like we're going to wake up one day like a sitcom and it was like, oh, this was a terrible dream. That's just not the way it's going to happen. What's likely going to happen is we're going to get to a point where right now we're at a pandemic and we're going to get to a level that's known as endemic, where we do see cases, but at much lower levels, and it's more cyclical. We have certain seasons, kind of like we do with the other coronaviruses that, give us minor colds, some minor cold symptoms, and we don't really think much about them. But to get there, it's just going to take some time.
So, and then my last question is simply, what are the long-term impacts do you expect, once we're out of that pandemic phase, as you mentioned, what do you expect the long-term impacts to be on our society, on people like you that work in the epidemiology field? What do you expect?
I think, this really gives us as a society, better insight into the importance of putting resources into science and into people, and in particular, very vulnerable populations. So, at least that's what I hope, that we always remember that we have to be prepared for these low probability, high consequence events and be prepared for them, and make sure in preparing for that we prepare in an equitable way.
Well, we sure appreciate your time. I know you've got class this afternoon, so we'll let you head off and say goodbye. And thanks again. And I look forward to hearing your talk at UNT tomorrow.
Thanks so much, Paul. See you tomorrow.
Thank you. All right. Well, now we're going to shift gears and talk a little human resources with our Chief Human Capital Officer, Shereen Gilliam-Holmes. Shereen, if you want to pop on your camera, we'll begin talking about everybody's favorite survey, the Gallup Engagement Survey. So we just got that in our inboxes this week, Shereen, on September 27th. Actually, yeah, Just got that. Why do we do this survey every year?
Well, hello everyone. Hi, Paul. And finally, nice to meet you, Dr. Cervantes. So the Gallup survey. The purpose of the Gallup survey really is that we need to hear from our employees about their experiences and identify ways to increase employee engagement that leads to high performing teams. As a UNT World employee myself, not having a regular survey sends a clear message to me that you don't care about my opinions or my experiences. So when I arrived in January, I was pleased to hear that UNT World conducts an annual engagement survey to give employees a chance to use their voice. Currently, the Gallup survey is our best tool to give us feedback and trend analysis on our quest to be a best place to work. And it gives managers a framework to use to have more meaningful and motivating conversations with their employees. We use the engagement survey to capture a snapshot in time of our engagement across UNT World. And the survey results really provide valuable insight and clues into each team's unique engagement story.
Well, as I mentioned, we just got the survey. I already knocked mine out, so I'm good. But I know often we like to point to the participation rates to make sure everybody keeps it in mind. So where are we in the early going as far as participation by institution across the UNT system?
So shout out to R. Mark Miles. He was gracious enough to provide me some data points for today. So as of 10 a.m. today, system administration is at 44%, HSC is at 54%, UNT Dallas is at 32%, and UNT is at 28%. And we really hope to increase participation rate for each campus over the last year, with the bottom line goal to surpass the Gallup Higher Education Index benchmark of 69% participation rates. The link to the survey was sent on Monday around 8 a.m. from Gallup. So if you have not completed the survey, I really encourage you to take a few minutes and share your voice, share your perspective. And the survey closes on Friday, October 8th, just as a reminder.
Sharine, a few weeks ago in Chancellor's Advisory Council, we heard the presidents talking about the Gallup survey, as well as our Chancellor and various leaders. And they were talking about actions that we've taken based on results and really utilizing the results to hopefully improve engagement and become a best place to work. Can you kind of share what actions are taken based on the results of the survey?
I think in a nutshell, what I've seen is that we've moved from talk to action. Led by Chancellor Rowe, we had a lot of open and honest conversations about how can we get to great and what getting a 5 in any of the 12 questions really requires of us as leaders. We also shared best practices and different action plans for managing engagement issues. We encourage leaders across UNT World to engage in open and transparent dialogue with their staff about last year's results and discuss ways to improve engagement. The Organizational Development and Engagement Team, also known as ODE, help leaders across UNT World devise action plans to focus on how we integrate engagement as part of a team's DNA and daily routine to really foster a work environment that creates an engagement story in which every team member matters. And just as some highlights, ODE offered 12 engagement-focused trainings. They also offer 26 team-focused engagement discussions and action planning consultations. HSC developed an engagement champions program to promote workplace engagement. So it's really through initiatives like this that many managers have started to lead their teams to have a very collaborative discussion on how to improve engagement. I can't hear you. Oh, you're muted, Paul.
I accidentally hit mute. Who knew? My apologies.
I was like, wait, I thought it was me.
I'm back with you. So as far as the data that is distributed to supervisors, when is that going to be sent out? Obviously after the survey period, and can you kind of talk about how that is distributed?
So yeah, everything is managed through the Gallup portal, and the engagement data will be available to all employees through the Gallup portal on Wednesday, October 13th. And you can reach the Gallup portal through the HR website under employee resources.
And I know my team will be sending out communications about that, as well as the teams at the campuses. So we'll make sure everybody's given a heads up when that arises. So you talked a little bit about some trainings that Gallup offers, but what other resources are available for supervisors to really better understand and utilize that data to their advantage?
There are extensive resources available through the Gallup portal, as well as the Gallup ODE webpage. And in addition, the ODE consultant, they're available to conduct any kind of engagement action planning, teamwork sessions. They are readily available to managers and their teams. And if you need help with any aspect of the Gallup engagement survey, I really encourage you to reach out to ode@untsystem.edu. That's ode@untsystem.edu. Or of course, you can send me an email and I'll get you over to the right consultant.
We appreciate that. Now, one question that comes up a lot is this really anonymous? So can we provide some assurance that your feedback is anonymous and it won't come back to anybody?
Absolutely. So no one in UNT World has access to survey participant names, not even me as the Chief HR Officer. So, please rest assured that it is anonymous. But teams with fewer than 4 survey respondents actually roll up to the next supervision level. And that way, no individuals can even be singled out, even with smaller team units, which sometimes people ask about as well. So nope, not even me. So please rest assured your response is anonymous.
Appreciate the clarification. So one more Gallup question, and this one was submitted by an employee, and thank you for sending that our way. The question is, when Gallup asks us to rate our organization, should we just base it on our immediate supervisor who has a small team, or a small team of direct reports, or the department as a whole?
The rate your organization is really about the entire institution. So we really want your overarching feedback on your experience through the, as an entire institution.
Got it. Well, before we shift gears, I'll give one last reminder to all of our colleagues. Please complete the Gallup survey. It helps out everyone out in the long run. And Shireen, let's move on to our next subject, our employee assistance program. And really, based on the questions we received prior to this town hall from employees, it's clear that a lot of us are still working through pandemic-related challenges. And I know you and your team have been focused on providing better mental health resources to faculty and staff. So with that in mind, let's talk about one of those new resources. We had an EAP, but now we have a new one that's provided by CompPsych. So this EAP became available on September 1st. Can you kind of talk about why we made this change?
Sure. Our community needed more. We wanted to offer our employees and their families a more robust suite of services, easier access via a downloadable app, and user-friendly website. And we also want to work with a vendor who would be our partner in ensuring a holistic, comprehensive, and personalized experience. The sources of stress, we all know, are multifaceted, and we really want to present different ways to alleviate it. Additionally, CompPsych manages our family medical leave, which afforded us an opportunity to both consolidate contracts and receive better services.
So who is eligible besides just the employee? We say dependents. What does that mean exactly?
Well, for the EAP program, services are available at no cost. I'm going to repeat that, no cost to active and retired employees, as well as any members of their household. So that's anyone that is living in your household. It's not just dependent specific. So it's a really broad service.
Well, let's get into a little bit more detail on the mental health support. So what's offered in this EAP, and is it an upgrade to what we previously had from a mental health standpoint?
Oh, absolutely. This is a major upgrade for UNT World. Our new EAP, Guidance Resources, is the name of the EAP. It's administered by CompPsych, which is what Paul mentioned. But our new EAP offers confidential 24/7 multilingual access to both master's and doctoral level professionals, and uses what's called a 6-session model. Previously, we had a 4-session model. So a 6-session model really is that employees and their members of their household get six sessions per person, per issue, per year. And I want to repeat that because that's really important. It's 6 sessions per person, per issue, per year. And if more sessions are needed, CompPsych will make every effort to transition individuals over to providers who accept our employer insurance for follow-up care. And as we know, mental health includes our emotional, psychological, and social well-being. And our EAP really helps to address a wide variety of emotional well-being issues for both the patient and the caregiver. And, including but not limited to things like addiction, ADHD, Alzheimer's disease, anxiety, invisible disabilities, depression, both clinical and postpartum, sensory processing disorders, eating disorders, suicide, stress, phobias, the list goes on. So we definitely have upgraded our offerings by switching over to CompSite.
What's the best way for employees to learn more about how to take advantage of the EAP or other benefits for that matter?
So we have several ways that you can learn about our EAP. Obviously, your campus HR team is always here to help. So you can always reach out to a contact member if you have any questions that need answered. Also, you can download the Guidance Now app on your Apple or Android device. You can also visit guidanceresources.com and use the web ID UNTS, and just visit the HR website and look under the benefits tab for employee assistance program.
Great summary, Shireen. We appreciate you sharing this new benefit and to all your team that worked so hard to bring this to us. We really do appreciate it. You're not done yet, though. We're going to keep going with some questions, but we are going to bring Chancellor Rowe back. Lisa, if you'd like to turn your camera back on. We've got our employee questions, and I'll just kind of bounce back and forth to both of you. Don't turn your camera off, Shireen. We want you on too. We've got both of you. In fact, I'm actually going to start with Shireen, and I'll just kind of bounce back and forth a little bit. But the first one, Shireen, I wanted to address an item that we're not going to take a deep dive into today, but clearly it's on the radar of President Smotrisk and the HR team at our flagship institution. So we heard many questions from UNT faculty and staff regarding compensation. The President mentioned it in his State of the University speech that he gave recently, including, merit, equity, cost of living adjustments. Really too many questions for us to answer in this forum. And, we're not diving into one institution. We're trying to take a holistic approach at looking at the UNT system. But I understand the President did send recently an email to faculty and staff clarifying many of these questions. But if faculty and staff at UNT still have questions, who can they contact?
Oh, employees should contact their supervisor. The distribution and allocation of merit pools are at the division and department level. So it's appropriate that employees discuss questions about the impact of merit and equity pools and any other salary concerns with their supervisor. Got it.
All right, Chancellor, we're going to put you back on the hot seat here. And this is another one where we received several similar questions about UNT's COVID testing program. And I know there's been a little change in how that all works, but the question that we received really many times was, why do people that have been vaccinated for the coronavirus get to opt out of the mandatory testing program at UNT?
Well, let's see. Well, I'd like to start with the good news is that the testing program is working. It's evidenced by the recent data and the downward trend. And so earlier, you're right, some things have changed, Paul. Earlier this week, President Smotrisk announced that UNT is going to move from mandatory testing for faculty, staff, and students to random testing. And that program is detailed on the university's Health Alerts website. UNT instituted this testing program with an opt-out because the data shows that vaccination data clearly that COVID spreads at a lower rate than it does for unvaccinated people. And that the data also shows that vaccinated people test positive for COVID. If they had a breakthrough case, like you heard from Dr. Cervantes, that their symptoms are significantly reduced, and it's rare that a hospitalization is required. So that data drives us to encourage vaccinations, and we believe the incentive of opting out for vaccinated does ultimately help our students, faculty, and staff stay safe. And so that is what we're focused on, is keeping our students, faculty, and staff as safe as we can.
Got it. Makes sense. I'm going to go back to Shireen here on one. I know we were talking about the EAP benefit, but we did get a question in a few different ways related to benefits. I think people, as we've gone through this pandemic, are really taking a closer look at the benefits package that is offered to our employees, our workforce. So can you elaborate a little bit on benefits as a whole, not just the EAP that we just addressed?
Oh, sure. Well, first, we have some really great benefits across the UNT world that I don't think we promote enough, and we're going to be better at that, I promise. But our role at UNT World is really to support the whole employee. We have really robust healthcare coverage plans currently administered by Blue Cross Blue Shield of Texas. And as a state employer, we provide employee-only coverage at no cost to the employee, along with a $5,000 term life insurance policy for the employee. In UNT World, we also pay 50% of all dependent medical coverage. In addition to that, available through our health coverage, we also have access to an extended network of behavioral health experts, virtual visits, Well on Target, which is a health and wellness program, which offers wellness assessments, and a fitness program, which I personally love. You can do both live and on-demand classes from the comfort of your own home. And so I particularly love that option. We also offer Smart Dollar at no cost to all full-time UNT World employees, which is an online financial wellness solution that helps employees improve their money habits by helping to manage debt, helping budget, save for emergencies, and hopefully retire with confidence. And just as a plug for UNT, today is the last day for those at UNT who have not signed up for Smart Dollar to be entered into a grand prize drawing to win a pair of tickets to a 2021 Cowboys home game. And active Smart Dollar users, you are already eligible. So all the UNT employees out there, sign up for Smart Dollar today to get eligible to win those tickets to that Cowboys game. Although I'm a Giants fan, I'm from New York. So we do have also employee, retiree, and dependent educational scholarship programs, which pay some costs related to tuition and fees. And let me see what else. For the EAP, I think this is a lot of things that people don't know about our EAP is just really how much they can help you if you just take advantage of the service. And I'm just going to briefly go through this because it really just helps you manage everything that's the responsibilities that we have, right? So like wellness, they have emotional well-being, fitness and nutrition, grief and loss, personal growth, mindfulness, managing stress. If you need legal advice, you can use that 6-session model, remember, that I spoke about earlier, for legal advice for divorce, adoption, family law, wills, and trust. You can get financial counseling for retirement planning, taxes, estate planning, debt, bankruptcy. Also, if you need help securing childcare or elder care, they can help you. They have also resources on special needs and gifted children. If you have a child in K through 12, they can help you find a school and extracurricular activities in your area. There's also a complete lifestyle section that covers everything related to pets, like pet insurance, computers and electronics. They can help you plan an event, plan travel. And we also have access to some exclusive discounts through Working Advantage, all through the EAP, that gives you discounts for like movie theaters, theme parks, ski tickets, Broadway theater, shopping, hotel stays, and more. So really a great suite of benefits that we have across UNT World. And to all the UNT World employees that are listening, if there's something that you need and you feel like we don't have right now, and you don't have access to it, please feel free to contact me or any member of the HR team and let us know, and we'll do our best to try to meet you where you are.
Well, Shireen, we'll help you, my team, in putting the word out about these benefits as well. Shout out to my guy, Jeff Kaplan, who puts together our HR Highlights newsletter every Thursday. It goes out, and it will have a section in there where we're spotlighting these benefits and helping people take advantage of that. So thanks for your team's hard work in that area, and we'll do our part in helping get the word out. Chancellor, another one for you, and we're kind of on a theme with the questions that I've been given to you, and this is another testing vaccination question. And really, it's the other institutions asking, are the Health Science Center, UNT System Administration, or UNT Dallas going to consider implementing a program similar to what UNT has done as far as vaccination or being able to opt out, testing, or being able to opt out of testing if you have a vaccination card. So can you kind of address other institutions there? Is that in the works?
Yeah, no, we don't have any plans to institute required testing at any of the other institutions, any of our other universities. And right now, I mean, all of our universities have put in place, great protocols, great approach, taken significant precautions. We think all the right things are being done, and the Delta variant spike is, it's on the downward side, or at least that's what it looks like right now. So no, we don't plan to do that at this point. And even UNT has moved to random testing at this point.
Thank you for clarifying that. And we did hear some good news from Dr. Cervantes there on that subject too. So Shireen, a question for you now. We got lots of questions for you on this town hall. Is there a substantial difference between flexible work arrangement policies across UNT World. So by institution, does it change? And then I have a follow-up to that, but I'll let you address that part first.
No, there's really not a substantial difference between the policies. Maybe the approval process, but not a substantial difference between the policies.
The follow-up was, will more positions move to a hybrid remote, on-site, sometimes remote, sometimes model in a permanent way, and not just temporarily? Do you see that happening?
Well, flexible work arrangements really require a significant communication and collaboration between supervisors and their staff. And decisions are really driven by departmental operational needs and job requirements. So across UNT World, we're obviously working to integrate more flexibility in general, but it really, again, depends on the specific needs of the department. Employees and supervisors must follow, as I mentioned, the approval process outlined by each campus. And you can find more information about the flexible work arrangements under the Employee Resources tab of the HR website if you have any more questions. And myself or any HR team members here to help you navigate that as well.
Appreciate that. Chancellor, here's a question for you that it came from an HSC employee asking us about remodeled classroom spaces, workspaces, student faculty shared spaces, but really leads us into a broader question about office, classroom, common space throughout the UNT system. So what is our philosophy around space usage and reconfiguration as we emerge from the pandemic?
As we emerge, we've learned a whole lot from, as we've gone through this. I learned a lot about filtration and sanitation, good practices there and the need for physical separation and how and a lot of that we've learned, we're gonna make that permanent. We're gonna take a lot of that forward. We've learned about learning spaces and how we can better design those, even how we better use a lot of our space. We learned maybe we weren't using some of it the best we could, right? And so Steve Marachevsky and his team and the facility teams at all the campuses have been fantastic. They've really been focused on that, looking at that and focusing on how we can make space more flexible and more safe for our students and for our faculty and staff. And as far as Health Science Center specifically, they've moved away from fixed chairs and tables to flexible learning environments where you can reconfigure it. So that's going to set us up so well for the future. And again, we're moving that way, and ultimately, I think it's going to make us where we're going to use our space better in the future, and that's and dramatically change our learning environments so that we'll be able to, I don't flex to whatever comes our way in the future. Not that we want any more of this coming our way, but that's what we've been doing.
So one thing we've learned is to be adaptable during this pandemic, right?
That's right.
Shireen, we've talked a lot benefits, and I've got another one for you. I'm going to read this one verbatim as how it came to us because it's a little bit nuanced. Question says, regarding employee benefits, could we have access to a long-term care insurance option? TRS has one, but when I inquired about it, they said it was for K through 12 school employees. With the uncertainty on the horizon about Social Security and Medicare continuing to be funded and or running out of funds, having a long-term care policy is increasingly important.
So I too will be reading this answer because I had to say, what? But thank you to Dr. Shell because she really helped me answer this question. And I'm going to read a little bit about the history here because benefits offered by the Teachers Retirement System of Texas really apply to ISD employees. And the benefits offered by Employees Retirement System, ERS, of Texas apply to higher education employees. The benefits do differ across the two systems. Now, Donna did inform me that ERS did offer a long-term care program at one time, as did UNT, and that both plans were discontinued when the providers determined that it was not financially beneficial to continue offering long-term care benefits as a group program and then move to individual policies only. So the majority of insurance companies nationwide now no longer offer group long-term care programs. However, this is something that we will certainly investigate as a potential future benefit.
Got it. And shout out again to Donna Shell, our Director for Benefits, for helping us on that one. And Lisa, I think we've answered this next question several times, but we keep getting it. So I'm going to read it as we received it and let you clarify it one more time. Question came like this. It is my understanding that masks will not be required for the following groups: employees working events, students participating in events, family, friends attending events. Is this true?
Are not requiring masks, but we are, however, recommending uses of face coverings indoors for our campuses. I've just been out at over the last week at all of our campuses, and everyone's wearing them indoors. I mean, and so it's recommended, but it's not required. Again, as a public university in Texas, we follow guidance from the governor's office, and Governor Abbott has stated that we will not be mandating masks, and so we're not mandating masks, but certainly we're recommending, and that's something, you know, that looks like a lot of folks think is what they want to do, because I'm seeing folks wearing masks out at all the campuses when I go out there. So that's where we are.
We asked Dr. Cervantes about it too, and she said it's just another layer of protection that can help all of us.
It's a good thing to do.
Absolutely. Shireen, I'm going to come back to you for a couple, and then we've got a final question for the Chancellor. Again, I'm going to read this as it came in. I have been vaccinated. However, given my age and certain other physical conditions, I am very uneasy about possible exposure to coronavirus. On the other hand, I do not wish to jeopardize my job. What are my options?
Well, first, I would say that across UNT world, the safety of every member of our community is the top priority. Various teams across each campus have worked tirelessly to ensure a safe return to the office and campus. However, every employee situation is unique, and having more information would help to assess this particular situation. So I would ask that if you are an employee and have this question, please feel free to contact me or any leader of the HR team. We have Katie McDaniel at UNT, Janine Watkins at HSC, Wanda Boyd at UNT Dallas, and Donna Asher here at System Administration. And we'll be happy to consult with you and identify the best course of action.
Appreciate you guys being available like that. Here's your last question of the day, Shireen, at least from me. Previously, an announcement was made that there will be changes being made to the faculty, staff, retiree, dependent scholarship benefit. And you touched lightly on that earlier. So what is the status of these changes? Will this vary by location, and when will we expect changes to be announced?
So I'm very happy to report that, we believe that this scholarship benefit is an important benefit to our employees, and have decided to not make any changes to the benefit at this time. And the current benefit program will continue.
Got it. Thank you very much. And Chancellor, we're going to close with a question that makes me really sad to ask. How is the search going for a new chancellor?
Well, let's see. I just talked to Chair Wright, our Board of Regents Chair, Laura Wright, this week, and she said things are right on track and everything's going really well. And so that's great news. The other great news is we're in a great place. I mean, we're just at a wonderful place. We've got a wonderful team in place. And so I feel really confident in continuity, and everything's going to go just fantastic. Just even better than when I'm here, right? But at the same time, I want to say I haven't slowed down one bit. If anything, I've sped up, and we'll be running all the way through the finish line. So there's a lot of things to do between now and the end of March, and I'm just excited to get to work with this team and make all these wonderful things happen.
Well, thanks, Lisa. I know I speak for many when I say your leadership has meant a lot to all of us, and we definitely do see you running towards the finish line, and we're still going to be sad when you go. So thank you for everything. And that concludes today's town hall. So thank you to Dr. Cervantes. Thank you to Shireen Gilliam-Holmes for joining us, and certainly Chancellor Rowe. And thank you most of all to our faculty and staff for tuning in, sending questions, and participating in today's webcast. Have a wonderful afternoon, everyone. We'll see you in our next town hall in December with the presidents joining Chancellor Rowe. So